This is a case of a basilar tip aneurysm that was endovascular embolized using the Y configuration stent-assisted coiling technique. This is a 64-year-old female who presented with a 2-week history of severe headaches. She described as the worst headache of her life. She was neurologically intact with no focal deficits. Patient was on aspirin and clopidogrel for cardiac stents. CT scan demonstrated minimal amount of subarachnoid hemorrhage and no hydrocephalus. In these angiographic pictures, you can observe the relatively medium-sized, wide-base basilar tip aneurysm. Because the wide neck configuration of the aneurysm neck, this aneurysm requires a stent-assisted coiling. In this case, we're going to perform a Y configuration stent. You can observe here the guide catheter that has 2 different microwires. On the roadmap magnification, the left posterior cerebral artery is now selected with the microwire followed by the microcatheter. Carefully and avoiding going into perforators that come off the basal artery, the left posterior cerebral artery is now selected. We remove the microwire and the stent, in this case an Elvis stent, is then bring up into the left posterior cerebral artery. The next step is to navigate the coiling microcatheter into the aneurysm. This has to be performed very meticulously to avoid perforation of the aneurysm. This is probably the most critical care step of the procedure. Once we have a first loop of the coil inside of the aneurysm, the second step is to deploy the stent from the left posterior cerebral artery into the basilar artery. This is performed with a unsheathed maneuver. Here you can observe that the stent is deployed completely. Now we continue with navigation of another microwire, another microcatheter, now into the right posterior cerebral artery. Similarly to the previous stent deploying, we have to bring the microcatheter distal enough into the P2 or P3 segment of the artery. We remove the microwire and the stent is brought up. Here now you can see how the stent is then deployed. This second stent is also an Elvis stent. At this moment the stent is almost deployed completely and both stents can be observed in the Y configuration. The next step is to continue the coiling of the relatively medium-sized basilar tip aneurysm. The coil is being pushed slowly, letting the coil take the shape of the aneurysm. Because we have now 2 stents covering the neck of the aneurysm, we can be confident that the coil mice will stay in the aneurysm and not protruding into the basilar artery. Multiple coils are then inserted until obtaining a good obliteration of the aneurysm. At this moment, the aneurysm is still patent, as you can see in this image, and on the roadmap another coil is inserted slowly into the aneurysm. In this final run, you can observe the aneurysm completely obliterated with the two stents. Final runs demonstrate adequate aneurysm obliteration and patency of the stents and distal branches.